Hello, I am Dr. Natalie Lenor Blackman. I am the owner and founder of Wellbeing Medicine for Animals. It is a holistic veterinary practice, and I have recently formulated an online program, a detox protocol called Dr. Natalie's Holistic Pet Reset, which is the reason why I am starting this YouTube channel. And so I don't know if many of you understand, but those of us veterinarians that have been in the trenches, that means in the clinics, seeing patients on a daily basis, we don't get the luxury of going online and educating and doing podcasts and videos because we are working. We work all the time. We work every day. We're trying to help make a difference in the world with the patients that we see. But what I have found more recently in the last over the years is that the difference that I'm making may be great in the small amount of patients I'm able to see in my practice on a regular basis, when in fact we need to get this information out to more people so that we can see pets thriving across the globe. Right now we have an epidemic of sick pets, and that is because they are caught up in a traditional system of symptom care and chemical overload. And so we want to start talking about these issues and bringing them to the forefront and trying to help you understand what you can do to help improve your pet's quality of life and also to help improve longevity. Right? So it's not just about quantity of life, but it's about quality of life. And so at my clinic, our goal, we say, is to reverse age. And we like to see the patients that come to us thrive and feel younger with each treatment. Now, granted, I am able to do acupuncture on those patients pretty regularly, and I am a strong believer in acupuncture. And so if you do start following this YouTube channel, we can help you locate holistic and acupuncturists in your area, and which can further benefit the life and the health of your pet. But one of the things I teach at my practice, and I'm very big on, is called proactive care. And proactive care keeps us from having reactive care. Reactive care is when we find ourselves in a situation with a sick pet, whether it be a dog or a cat, right? All of a sudden they are what we call ADR, ain't doing right. That's what veterinarians call it. Or they're lethargic, or they're not eating, or they're vomiting, or, they've lost function in their, hind limbs, or they're getting weaker. We want to improve health and to prevent those particular issues. One of the biggest goals in my clinic is I want to prevent the itises, right? So I want to prevent pancreatitis, gastroenteritis, cholangiohepatitis, arthritis, glomerulonephritis. And so all of the itises are a type of inflammation in the body, and we do not want our patients experiencing inflammation, because inflammation is really just uncontrolled immune system. It's usually a dysfunctioning of the immune system, and it's usually comes from an unbalanced gut that does not metabolize food correctly. And of course, inflammation can also come from a liver and gallbladder that is unable to detox correctly. And so we get a lot of dysfunction. We get cellular dysfunction, we get immune dysfunction. And so that is a very important goal at my office. And if you know any of my clients or were to talk to any of my clients, they can tell you right away, I do not want to see an itis. We don't want repeat illnesses in our office. We don't want our clients coming back for the same problems over and over again. We want to restore health. And so the way that we do that is we practice something called proactive care. So we get ahead of the problem. And one of the ways we get ahead of the problem is by preventing and balancing imbalances in the body. So if the body is off just slightly, we don't want to give the body a medication which is going to just cover up those symptoms, which is the off just slightly, right? Because when we do that, we're going to push the disease further into the body. We may not have symptoms for a little bit, right? But they're inevitably going to show up in another place and another time, because symptoms are actually like little road signs. They're telling us that the body is not healthy. And so there are little bitty symptoms that we can pay attention to One of the most common small symptoms I see at my clinic with new patients is a change in their coat structure or their coat texture. And most oftentimes it occurs right here on the front of the arms, on the side of the front legs. And then it also occurs on the sides of the back legs. And there are several energy meridians, or what we also have learned to discover that energy meridians in the body are actually called premovascular lymphatic channels. So these meridians where we put acupuncture needles in the body, they are actually carrying not only lymph fluid, but even stem cells. That has been discovered it was discovered 50 to 60 years ago, but that information was lost, and so it's been rediscovered here in the last decade. So it's a lot of really great information that we have coming to the forefront about how important acupuncture is. But going back to those little bitty symptoms, right? So something as small as this coat change, and if you look on your own dog, you may notice that. Like, they may have a really smooth coat, but right on the sides of the front of their legs, it looks very fuzzy, or it looks like a different texture, or it's growing in the wrong direction. And so that is letting us know that we have stagnation in those lymphatic channels. And there's a very common channel on the front legs called the triple heater. And so that is a place where when heat or inflammation is rampant in the body, it will tend to back up into the triple heater meridian, which runs along the side of the arm like this and kind of down over the elbow, and then comes back across to the front of the leg and down right about through here. And so that triple heater will oftentimes get inflammation or congestion from the lymphatic fluid from that imbalance in the body of heat or inflammation and or infection that could be chronic, and that will actually change the coat texture on that front leg. Another place that we will oftentimes see that coat texture change will be in the hind limbs, and that is in the gallbladder meridian. And so in my clinic, I have found the gallbladder meridian to be a type of the gallbladder to be a type of silent disease. He can also, if not corrected, be a silent killer, but we do not want that, right? We're trying to prevent disease by being proactive. This is one reason why I founded my first supplement, which is in my supplement line called Divine Synergy, and this supplement is called Bile Balance. And the reason why I created that was because over these last 10 to 12 years where I've been practicing just holistic medicine, I have noticed this coat change pattern in the gallbladder channel. Oftentimes the gallbladder channel and the triple heater are connected, so we tend to see those together, especially in a pet that's had long-standing inflammation. So just a little understanding of what these tiny symptoms may indicate. Then, of course, we have much bigger symptoms, right? We have maybe chronic otitis in the ears, like chronic ear infections, whether it's in the left ear or the right ear matters, okay? We also may have paw infections where they may lick and chew their paws, whether it's the front paws or the back paws, that matters. The location of where they're licking, that matters. They may actually be doing their own acupuncture because the acupuncture meridians drain down through the limbs and out through the paws. And so sometimes dogs are intuitive enough to know that they need to move this stagnation. So they will overgroom these meridians and or these lymphatic channels in hopes of getting that stagnation to release. So again, that's why I say acupuncture is so important. Acupressure can be used as well, but sometimes dogs are doing their very own acupuncture through that over grooming or stimulating the lymphatic flow. And so we talked about just some simple road signs that may be telling us that there's something off in the body. And when we start to look at those little signs as something important rather than something to just treat and make it go away, then we can begin to walk into what we call proactive care. And so our clients know, we say there's no symptom too small. I'm never going to be frustrated with anyone that comes into my practice for something tiny because I want to know about what's going on, and especially if something has changed within their pet. Our clients know their pets very well. In our office, pets are family. And so people tend tend to pick up on their tiny symptom changes or imbalances pretty quickly. And what we have learned over these years is that the earlier we address these, the less problem we have. One of the common issues that I see in my clinic all the time are dogs that have had issues, these symptoms going on for 6, 7, and 8 years. And so that's a much harder place to begin to correct an imbalance. But once you learn about proactive care, and or if you're a new pet owner, the earlier that you learn about proactive care, the healthier your pet will be. A little background about me is that I was in an emergency critical care field for almost 8 years. And so that was before I went into a just full holistic type of practicing. And when I was in that emergency field where I saw emergencies all day and all night, you begin to start saying, okay, we've got to be able to correct or prevent these issues before they come to this place. Now, granted, we can't always change situations such as a dog running out in the street and being hit by a car, or falling off of a retaining wall and breaking a leg. That's a different type of emergency. The emergencies that we're talking about preventing are emergencies like the itises, right? So the pancreatitis, the hepatitis, the cholangiohepatitis, the gastroenteritis. We want to prevent these itises, and the way that we do that is through proactive care. So one of my goals for this YouTube channel is to begin teaching that, and teaching it in accordance with the Chinese medicine theory, which is what I practice the most in my office. And in the Chinese medicine theory practice, we use the seasons and the elements. And so I teach more of this in my Dr. Natalie's Holistic Pet Reset. I'm also putting together a food course as well, and I'm going to be working on and hopefully launching soon an entire course on Chinese medicine where I teach each person how to correct their pets' imbalances from season to season, because the Chinese medicine theory is based on elements, and that is the fire element, the earth element, the metal element, the water element, and the wood element. And so those elements, we use those elements within the body, okay? And every pet is more predominant in an element. They may be more fire, they may be more wood, they may be more earth, they may be 1/3 wood, 1/3 earth, 1/3 water. So we actually have in that Holistic Pet Reset, I actually have an information page that you can go through and mark the element that your pet most identifies with. And also on that form, you can mark the imbalances that your pet is dealing with the most and or has dealt with in their entire life. I actually recommend everybody mark the ones that they have experienced throughout their life, whether they're having issues with them now or not. And that's because it lets us know which organ system has been crying out the most or which one is the most imbalanced. So we take those elements and we understand that the meridians running throughout the body are called the 12 major meridians. And those 12 major meridians run through each organ system and or element for 2 hours a day. Each element has 2 organs, so it's going to end up equaling, I'll show you the clock where you can see that each element will get about 4 hours per element for when the lymphatics flow through the body. And the reason why that's important is because we can find out that if every day at 6 o'clock p.m. our dog is having an issue, well, then it's most likely related to the kidney element. If they're having an issue at 6 o'clock a.m., then it's most often has to do with either the stomach and or the lung. And so we can begin to understand that when our pet is having an imbalance, the time of day, that can help us narrow down an even deeper issue of what organ or element system is currently out of balance and what we need to work on. This goes even deeper at our clinic, and we teach this element theory on a yearly cycle. So each element has a time of year where it is the most active, and it's its predominant season. And so we like to help teach our clients that they can balance their pets in the off season so that in their important season where they may experience some stress on that element, that they're actually going to be in alignment, and so they will flow through that season much greater. For instance, we have a lot of fire dogs that come to our office. Fire dogs are dogs that love everybody. They're super excited. They're full of life. They're very hyper. I wrote a book on doodles called The Happiest Doodle on the Block. And I wrote this book because doodles are predominantly fire. And fires do need a very specific type of care, because in our traditional setting, these fire pets can get really out of control with the traditional medicine and chemicals that are being put in our pets every day. Fires just cannot handle that. But so for instance, if we have a fire, their predominant element is in the summer. And when we want to anchor that element would be in the opposite time of that. That would be winter. And in fact, we just experienced that with a patient that normally we would be balancing this pet in the off season, and we did not. And in the winter element, this pet went into some severe kidney issues. And that's because in the summer, the fire had drained all of the yin, or the fluid, from the kidney. It actually drained what we call its essence. It depleted it. So when the kidney season, which is the winter time, rolled around, the kidneys were not able to withhold or withstand any changes in temperature or lymphatic adjustments. And so that will cause a type of nephritis or glomerulonephritis. And so the more that we learn about correcting or preventing these imbalances through proactive care, the more that we can learn how to prevent disease and prevent emergency visits. Now, wouldn't that be fantastic? So that is the goal for this YouTube channel. I hope you'll follow along. I do not want these videos to be long, but I do tend to talk a lot about these subjects because they're very near and dear to my heart, and I want more people to have more information readily available for them. So I hope you'll join me for the next one as we continue talking about the winter element and maybe some things that we can do differently in time for winter season so that we can prepare the body, and in hopes of anchoring what we call yin and yang and getting it ready for the rest of the year. I hope you have a great day.